As we try and land these STPs, I would kind of think about three kind of sort of headlines, if you like. First is horses for courses. How the health and care system evolves in different parts of the country will look different. That's fine. One of my kind of guiding principles here is that it doesn't all have to look the same everywhere. The solution for Lincolnshire is not going to be the same as the solution for South East London. That's okay, but it does need to be a solution. So STPs are not a bidding process. Again, as Jim said yesterday, they're a problem-solving process. They are a way of having a focused, honest, trusted conversation about some of the elephants in the room, some of the big-ticket items, the difficult choices that need to be resolved. And how they are resolved will look different in different parts of the country. So it is horses for courses. But I think the second phrase that comes to my mind is, if not now, when? In so many of these conversations, and I've had the benefit of sitting down with 24 out of the 44 STP leadership groups, in so many of these processes, it's not that people don't know what has to be resolved. It's often that people have known about it for years, just the time has never been quite right. Well, it seems to me that at a point when our backs are against the wall, where we are at this point in the political cycle, where it's pretty obvious that the money's not going to work if we carry on as we are, then if not now, when? And so as we have a chance to sit down again in July, I'm personally with Jim going to do all 44 of these. I've blocked out a large chunk of July just to make sure we're having these very specific and important conversations. If not now, when? We've actually got to face up to some of the changes that we can see are required. So horses to courses, if not now, when? And then the last of the thoughts, it seems to me, is how big a team are we playing on? And I've talked about the Devon success regime. I don't in any way do anything other than commend really effective organisational leadership. And some of our most successful leaders, you think about people like Len Fenwick, who, as you know, has just celebrated 50 years as an NHS manager. Newcastle Hospitals just getting their outstanding CQC designation. I was chatting to Len earlier in the week, and I think he's written a piece in the HSJ this week as well. I mean, Len probably doesn't want to do a population-oriented ACO construct of some sort, and you know what? That's fine. But if David Sloman at the Royal Free and colleagues think that for their part of London, or Pauline Phillip for Luton and Bedford and Milton Keynes, then we should be supporting and backing that. But either way, this should not be the consequence of failed arm wrestles. This should be the consequence of thinking more broadly than individual institutions. It's both and not either or.